So my name is Michael Skovdal Rathleff. I'm a professor from Aalborg University. I'm very honored to be here today and talk about how do we navigate all these different challenges we have in our healthcare system. And if there's one thing you take from these next 15 minutes that I'm going to speak is that there are many challenges in our healthcare system. But what is the most important challenge among the many challenges? That's something we need to agree on because we need to pick out our must-win battles to solve the challenges in our healthcare system. Because we need to understand what the biggest challenges are in order to direct our efforts to those challenges that matter the most. And what are the biggest challenges? And who should we actually ask if we want to know where and what the biggest challenges of our healthcare system is? And who has the right answer? Is it me? Because I'm a researcher, does that give me credibility to say these are the challenges we should focus on? Is it the politicians? Is it the clinicians? Is it the patients? Who actually has the answer to this question? And today I'm going to take a broad perspective, both going on a more global, macro level perspective to talk about what are the global challenges. What are the challenges if we go on a meso level of the Danish healthcare system? Because that's where I want to tie in how we're actually addressing these challenges and figuring out what are the most important challenges in a Danish healthcare system. And then finally, I'll end up with this, let's call it a micro perspective, or maybe even the most important perspective of all, asking the patients, what are the biggest challenges that you experience? So that's the aim of this talk today. So if we go up on a broad level, we start out by looking at the United Nations, the Sustainable Development Goals. We have some goals that are based on healthcare. And if we look at these different goals, they're agreed by world leaders. So this is the top level people, not patients, that agree on what are the most important goals of health. It's reduce maternal mortality, end all preventable death. It's fight communicable diseases. It's reduce mortality from NCDs. It's prevent and treat substance abuse. So they're Sustainable Development Goals, Pillar 3. Then if we look at the World Economic Forum, because they asked Deloitte, a big company, to actually make a list of what are the biggest challenges in healthcare. And what they did was actually different than the United Nations. So they went around and combined an analysis of policy, research, and interviews with the leaders. They found 5 key challenges in our healthcare system when we look ahead. One is health equity. I've been talking to some of you today and yesterday, talking to the taxi driver as well, and I think health equity, social equality, is something that's also on the list or the horizon here in Croatia. It's the environmental, social, and government strategies needed for resilience. It's mental health care. We've already listened to that from the European nation as well. It's digital transformation. And that is born out of we don't have enough hands to solve all the challenges. So we need to also think, what can technology do for us in the future to reduce the need for all the doctors, all the nurses, all the healthcare professionals that are not there to help this aging population. And the 5th one is that medical science is advancing at a rapid speed. I'm a clinician as well, and if you're out in clinical practice and you need to keep up with evidence and what's the right thing to do, it's almost impossible because this field is evolving at a rapid pace. So these are the goals and these are the challenges if we go on a macro level. So now I'm going to jump straight into, from a global perspective, into a Danish perspective. I want to present a bit about how we're trying to solve some of the challenges at our university. I'm proud of being from Aalborg University because we're trying to attack some of the most pressing challenges in our healthcare system. So what we're working on at Aalborg University is what we call a new health mission. Our health mission at Aalborg University is that we want to go together, combine all these different the legal institute, the business institute, the social science and humanities, clinical department, Institute of Science and Technology. We want to bring everyone together, direct all the innovation, all the research towards the biggest challenges we have in our healthcare system. And the way we're doing it is looking at what are the challenges. If you look on the left-hand side, we're going outside of the ivory tower of what is a university and looking and asking leaders, policymakers, clinicians, and patients, many patients, and the ones that are actually working in the healthcare system. What are the biggest challenges that you experience on a day-to-day business when you try to solve the challenges? Then we ask, what are your needs? How can we help you? And where do you actually see the digital technologies can help you solve some of the challenges? That's one pillar of what we're doing. Then on the right-hand side, we're doing the exact same thing at Aalborg University. We're going out to every researcher that have just a small interest in our healthcare system, asking, where are the challenges that you see? Where do you think that your competencies can be matched to the challenges in our healthcare system? And right here, in this red center, in the nexus, where challenges meet the competencies of our university, that is where we direct our efforts into trying to solve the biggest challenges of our healthcare system. So that means everybody get on the same boat and we go into this direction. And I want to share some of the key challenges we're addressing at the moment in our new Aalborg University Health Mission. And maybe some of these challenges are unique to Denmark. Maybe some of them also apply to you, because one of the other key points from this talk is that the answer to the question of where's the biggest challenges will depend on who we ask. If we take a global perspective or if we take a local perspective. So key challenge number one is that we have a major challenge in communication, the digital communication between different sectors of Denmark. That's the number one key challenge. Number two is that we have organizational barriers between sectors. From primary care, we have an amazing primary care in Denmark, but still patients feel lost sometimes when they're referred from primary care into secondary care. So that is another key challenge. We have too little time and resources for the core task. As one of the GPs and one of the hospital doctors that I interviewed said, when I started in clinical practice 30 years ago, I felt like 95% of my time was aimed at the core task, helping patients. Today, 25% of my time is actually spent helping patients. All the other stuff is admin work, documentation. It's a challenge because we have less and less hands. How can we free up our time and focus on the core task? The next thing, social inequality. The patients that need it the most might actually get the least. And that is something I hear is such a challenge here in Croatia as well, with almost a parallel track between private healthcare and the public healthcare system. And the last thing is maybe something that's unique to Denmark, but that is that right now we are also undergoing a digital transformation in Denmark. But you know what? Even though we have funds to buy new technologies, we actually forgot to have enough time and resources to implement the technologies that we bought. So there's actually a challenge, number 5, in using the available technologies at this moment. So that is the lay of the land in Denmark with the 5 key challenges that we're addressing at the moment, getting everyone to focus our effort into going in the same direction. Now I want to jump down into what I call it a micro perspective, but this is actually the most important part of everything I'm going to say today, because when we go down, ask the patients, what's most important to you? What are the challenges to you? I think that needs to be part of the conversation about where to direct our efforts. I'm going to do a bit of the research we've done on this as well. And we've been focused on using this called priority setting partnerships. And it's a specific scientific method that actually came from Canada. It came from Canada, where it was actually politicians that used this approach to figuring out what is important to society. Politicians use this approach to decide what is actually the most important thing to fund our public resources on, so they engage the end users. And now I'm actually advocating to go back and do things slowly, but figuring out where and how to best use the money. So we've been using priority setting partnership with the scientific method to engage end users in understanding what is most important to you. And we've been doing this repeatedly within the field of chronic pain. Chronic pain is one of the biggest challenges in terms of the number of consultations to the healthcare system. In Denmark, we have 1 in every 5 suffer from chronic pain. And among this large group of patients suffering from chronic pain, 1 in every 10 have more than 20 healthcare consultations every year. 1 in every 10 have more than 20 healthcare consultations every year, 1.5 every month. So that burdens our healthcare system. We've been trying to understand what is actually most important to these patients. And I can see the time is running, and I just want to jump into the conclusions from everything we've done within the field of chronic pain, irrespective if you have knee pain or if you have shoulder pain or you have back pain. There are some key things that are most important to these patients. And I think some of them are important to us for the conversation that we're going to have these couple of days. Priority number 1 is actually knowledge translation. They want to get better care through research out into practice. It's a challenge that we have so much research on what to do, but in clinical practice, all the research is not being used. And the challenge is that we deliver inferior patient care, so there's room for optimizations here. And then the 2 other things is so important, and maybe this is a Danish thing, but patients want to do more themselves. As a lot of them say, I want to be able to be given the tools so I can manage my chronic condition. I don't want to rely on going to a healthcare practitioner. I want to be able to do things on my own to manage my own condition. Can you see we have a large group of patients that consult 20 times on average per year. And what they ask of us as researchers and healthcare practitioners is actually tools so they can do more themselves and avoid going to a healthcare practitioner. I think that's a beautiful target for the research ahead, to focus on how can we support patients to do more on their own, and thereby giving them what they want, but also reducing the pressure on the healthcare system. That's an amazing, interesting target. I don't think, at least from a Danish perspective, and I've looked at a European perspective on what is being funded at the moment, I don't think we're funding enough into the self-management aspect of these chronic conditions. But maybe it's also about, is it popular to actually say to some patients, you need to have less time with a healthcare practitioner and you actually need to do more on your own? This is also part of the social contract. What are the expectations from healthcare systems? I think it's a dangerous thing, and when I've been talking to politicians in Denmark, they're also afraid of saying we need to do less for some patients. But I think the argument to them is that, hey, patients actually want it. So we need to start asking who actually needs less healthcare. So the future healthcare challenges, it depends on who you're asking. Are you asking leaders, clinicians, or patients? They will point in different directions. And this may also differ in Croatia, in the UK, in Denmark, in the United States, both due to the mentality, the social contract, the expectations, or the way that healthcare is actually organized. But I think, and my main argument from these 15 minutes is that to navigate this horizon of the challenges ahead, we need to understand what the key challenges are, because we can't do everything. We need to come together, focus on our must-win battles that matter the most to the people in our healthcare system that we care about. And that involves both focusing on the patients, but also making sure that clinicians who are working in the healthcare system are actually supported. If you look at the burnout rates, the pressure of working in healthcare systems across the world, clinicians are also challenged because they're under pressure as well. And maybe some of these things should also be aimed at supporting clinicians so they don't burn out. So the global challenges, this is from Deloitte, the 5 key challenges. My key point is that these global challenges might actually be different from the local challenges that we have in every country. In every sector of our healthcare system, we need to pay attention to how we define them to be able to pick our must-win battles and focus our efforts. So the recommendations from this talk is that we know that our resources are limited. So we need to focus on not everything that is important, but the things that are most important. We need to choose our must-win battles, and we need to understand where they are and by who we need to collaborate with to solve these challenges, because healthcare or traditional public healthcare can't solve these challenges on their own. This is where we need to work with industry and patient and politicians and healthcare system, quadruple helix, to come together and solve these challenges. And then we need to come together and define this strategic plan where everybody needs to pitch in, because solving the challenges of a public healthcare system, that's a priority to all, not some, but all. And we can't afford not to come together when it's about our healthcare system, because the public healthcare system is the pillarstone of health in every country. Thank you.